The recent deaths of 3 individuals in Mammoth Lakes, California, due to hantavirus have raised significant alarm among public health experts and residents alike. Hantavirus pulmonary syndrome, HVS, is a rare but potentially deadly disease, and the deaths, occurring in the first few months of 2025, represent a concerning uptick in cases that have caught health officials off guard. What makes these cases particularly troubling is that they occur despite the absence of typical risk factors usually associated with hantavirus infections, such as large rodent infestations or direct exposure to rodent droppings. This anomaly has left public health officials scrambling for answers, and the situation has highlighted a critical gap in understanding the transmission dynamics of the virus. The fact that all 3 deceased individuals lived and worked in Mammoth Lakes, an area already known for its history with hantavirus due to the presence of deer mice, adds another layer of complexity to the situation. However, there was no definitive exposure site for these cases, leaving officials to wonder if there is an emerging, unidentified risk factor that could be contributing to the spike in infections. While mice were found in the workplaces of the victims, it is not unusual to find such rodents in the area, especially during the winter months. The real concern here is the lack of clear epidemiological patterns that would help pinpoint the exact source of exposure, which may imply that the usual preventive measures, such as controlling rodent populations and avoiding contact with their waste, may not be sufficient in mitigating risk under these specific circumstances. The timing of the deaths is particularly alarming, as hantavirus cases typically surge in late spring or summer, not the early months of the year. This unusual pattern further complicates the response efforts and underscores the need for heightened vigilance in areas where hantavirus is endemic. Health officials, including Dr. Tom Bu from Mono County, have expressed concern about the unpredictability of hantavirus activity in the region. Given that the disease can progress rapidly, often leading to death within 1 to 2 days of respiratory decline, these deaths serve as a stark reminder of the deadly potential of the virus and the need for timely intervention. The fact that hantavirus can be fatal in roughly 1/3 of cases makes it a particularly dangerous pathogen, and the lack of clear understanding regarding its transmission could lead to more deaths if left unchecked. The response from health authorities has been swift, urging residents to take precautions against hantavirus exposure. The recommended measures, such as sealing up entry points for mice, storing food in rodent-proof containers, and avoiding sweeping or vacuuming areas contaminated with rodent waste, are critical for reducing the risk of infection. However, the recent deaths suggest that these precautions may not be enough on their own, especially if the virus is spreading in unexpected ways. Public health campaigns should be expanded to ensure that everyone in the region is aware of the full range of risks and is equipped with the necessary tools and knowledge to protect themselves. Further complicating matters is the broader issue of public complacency. While hantavirus is not a disease that is top of mind for most people, the recent cases serve as a stark reminder of how quickly a rare disease can become a public health crisis. The tragic deaths in Mammoth Lakes highlight the vulnerability of communities that may not be fully prepared for such outbreaks, especially when public health guidelines are unclear or incomplete. The current outbreak emphasizes the need for greater investment in research to understand the full spectrum of hantavirus transmission and its potential for seasonal variation. Public health authorities should not only be focused on immediate containment measures, but also on developing long-term strategies to prevent future outbreaks. In light of this recent surge in cases, there is an urgent need for a more robust public health response, one that includes better surveillance of hantavirus activity, clearer communication about the risks involved, and more effective prevention measures. The fact that hantavirus has been a persistent issue in Mono County for decades, with more recorded cases than any other county in California, indicates that this is not a problem that can be easily dismissed. With more than 90 cases of hantavirus infection reported in the state since 1980, California must continue to be vigilant in managing this dangerous disease. In particular, Mono County's ongoing issues with hantavirus serve as a crucial warning to other parts of the state that could experience similar outbreaks if preventive measures are not adequately enforced. The tragic deaths in Mammoth Lakes are a harsh reminder of the dangers posed by diseases that thrive in specific ecological niches, such as hantavirus. While the risk remains low for most people, the consequences of an infection are severe, and the absence of a clear transmission pathway in these recent cases should serve as a call to action for public health officials across the country. If the current outbreak continues to spread, it could lead to even more fatalities, especially if preventive measures are not followed rigorously. Public health officials must act decisively, ensuring that both the residents of Mammoth Lakes and others in areas at risk are fully informed and prepared to handle the potentially deadly threat of hantavirus.